What's up, gentlemen? I'm Junichi, a men's pelvic floor physiotherapist, and today we're talking about erectile dysfunction. Obviously, it's a condition that needs no introduction, and if you're watching this video, odds are you're looking for ways to fix it. So in this video, I'm going to break down why we as men get erectile dysfunction in the first place, and offer some tips on how to help it. So why does erectile dysfunction happen in the first place? In short, all sorts of reasons. There are psychogenic, neurogenic, vasculogenic, endocrine, drug-induced, and surgical causes. Let's break this down. Psychogenic causes have to do with the mental side of things. These are often feelings such as sexual performance anxiety, depression, high stress, perhaps some past trauma, or some relationship issues. Neurogenic causes involve disruption of the signals from the brain to the penis. These can be people with what's called peripheral nerve tension, where there's nerve tension from anywhere from the low back, glutes, groins, that's innervating that pelvic region. Or more seriously, central nerve issues, such as spinal cord injuries, strokes, perhaps Parkinson's. Keep in mind that if you've had a serious neurological trauma, and you know in full well that you can't achieve a nocturnal erection or erections when you're sleeping, these pelvic floor exercise techniques are not going to work for you. If this isn't you, keep watching for more information. Vasculogenic causes have to do with the blood supply. These are people who may have had trauma to the area or have had really bad holding patterns in their pelvic floor throughout their lives. Endocrine causes stem from a lack of hormonal production of testosterone, and these are fairly uncommon. Drug-induced erectile dysfunctions are usually a result of your medications, such as antidepressives or antihypertensives, and these are discussions that you need to have with your family doctor. And finally, surgical causes, such as a radical prostatectomy, where your prostate has been removed. On a side note, if you do struggle with erectile dysfunction and you haven't seen your family doctor for it, please ensure you go get that appropriate medical checkup, because erectile dysfunction is one of the first indications that you may have cardiovascular disease. On a physiotherapy clinical pelvic floor exam, people with erectile dysfunction usually fall within one of two categories. 1. People who have high resting tone in their pelvic floor, and they can't seem to learn how to relax that pelvic floor. And these are people whose erectile dysfunction might be stemming from that psychogenic or vasculogenic compromise. Discomfort can be trauma-related, such as an acute traumatic incident, or the trauma can occur over time, such as somebody who likes to participate in those ultra-endurance bike races. This cohort of people with the high resting tone in their pelvic floor often experience pain or discomfort, or have had chronic pelvic pain for a long period of time. And the second category are the people with the truly weak pelvic floors, and they need endurance training. These people are often the post-surgical, neurological, vasculogenic, or seniors with age-related muscle loss. That being said, it's not uncommon to have an overlap of symptoms, such as a weak and sensitized pelvic floor. An individual assessment is always going to be the gold standard to tailor a treatment plan specific to you. To assess the tone of the pelvic floor muscles, palpate your perineum, which is the spot between your anus and testicles. Then, gently move left or right until you feel a bony prominence, which is your sit bone. Applying a bit of pressure, if any of this is particularly tender, it is quite likely you have tension in your pelvic floor. One observable way to assess your pelvic floor muscle tone is to see the muscles using a real-time ultrasound. This is a biofeedback device that is placed on the perineum to assess the state of the pelvic floor during rest and at contraction. Specifically, we look at a metric known as the anorectal angle, which indicates the extent of tonicity in the pelvic floor. A relaxed pelvic floor will resemble an obtuse angle, with measures close to 120 degrees. A tense pelvic floor will look more acute, with measures close to 90 degrees. So for high resting tone, you'll want to learn how to relax your pelvic floor. For someone with high stress or anxiety, I would recommend you start with a technique I've covered in a previous video known as box breathing. It's a quick 5-minute evening routine where you breathe in for 4 seconds, hold for 4 seconds, breathe out for 4 seconds, and hold for another 4 seconds prior to taking your next breath. With practice, this will help down-regulate your nervous system to allow your body to make changes. The second treatment technique involves using 2 soft inflatable balls and gently placing them on your perineum. You want to think about descending your pelvic floor on the soft balls and very gently moving from left, right, up, and down, feeling for any spots of tension. For people who experience a lot of discomfort with this, you want to be able to breathe and embrace the discomfort that might be occurring. As you're breathing, you want to stay within the moment and let go of any self-limiting thoughts that you might have. You want to do this for a few minutes at a time, a few times throughout the day. And for the second group of people who have that true pelvic floor weakness, we need to begin a pelvic floor strengthening program, specifically focusing on endurance. To start, you can either be sitting in a chair or you can be lying down on your back, and you want to start pelvic floor contractions. To do this, I want you to have that tactile feedback by actually placing your fingertips on the perineal region. Perform a pelvic floor contraction by visualizing holding in your urine gently and shortening the penis into the body. What you want to feel is a contraction at your fingertips, and as you improve with this and get better, that tactile feedback becomes less necessary. I get a lot of questions from men asking, how am I doing? Am I doing this right? I don't really know. And to answer that, the best way to know for sure if you're recruiting your pelvic floor optimally is to use this real-time ultrasound scanner. As the pelvic floor muscles contract under ultrasound, we want to see a shortening of the pelvic floor muscles and a synchronous contraction. On the ultrasound, I get the men that I see with erectile dysfunction to try to hold their pelvic floor for upwards of 60 seconds. In physiotherapy, this is called the sustained endurance test, where we try to hold the pelvic floor in a synchronous manner for 60 seconds. On ultrasound, we see the strength and endurance of the pelvic floor, and often the men that I see with erectile dysfunction often fatigue way earlier than 60 seconds. So when you're practicing the endurance holds at home, use that tactile feedback onto your perineum and see how long you can hold on for. If you feel like you're losing the recruitment strategy, you probably are, and that's totally okay. All it means is that your pelvic floor is probably weak and that you should probably practice. So for the home rehab specific to erectile dysfunction, I would get you to perform 10 repetitions, 5-second holds for 3 sets. Then once you're finished, try to perform 5 sets of those maximal endurance holds until you reach fatigue. Please ensure that you have an equal amount of rest for every second you're holding your pelvic floor. If you can hold for 20 seconds, I want you to rest for 20 seconds prior to starting your next set. If you're wondering why pelvic floor muscle contractions can improve your erections, we have to look at the anatomy of the pelvic floor. The 2 muscles we are most interested in are the bulbocavernosus and the ischiocavernosus. These are muscles you can easily feel with your fingertips on self-assessment of the perineum. There's a small slip of the bulbocavernosus that arches over the shaft of the penis, and this muscle is responsible for compressing the deep dorsal vein, reducing venous return, or in other words, outflow of the blood from the penis. The ischiocavernosus, when it contracts, it induces this very high systolic pressure, or in other words, high amounts of blood going into the penis. Simply put, for an erection to occur and to maintain its firmness, more blood needs to be going into the penis than out of it. These 2 muscles need to work in coordination with each other. And to quickly talk about medications, maybe you've seen your doctor for this issue and you've been prescribed Viagra or Cialis. These are known as PDE5 inhibitors, usually a first-line treatment for erectile dysfunction, and these work by allowing this influx of blood into the penis. However, if you have chronic pelvic pain or you're otherwise a healthy young person, this probably isn't the right approach for you. If you have a pelvic floor assessment and you try to figure out the underlying problem, then you're not going to need this band-aid solution of the medications. On a side note, sometimes these PDE5 inhibitors will cause sinus irritation or flushing in your body, and it can lead to you having this erection for way longer than is deemed safe. Of course, I'm not trying to disparage it altogether. There are some population of people who do benefit from using those PDE5 inhibitors. So that's it. A few exercises to help you try to fix your erectile dysfunction. It's a condition where a lot of men feel frustrated, hopeless, and confused. And I will say that it is something that has a lot of individual variability, so seeing a pelvic floor specialist who can design and tailor a treatment plan for you is key. And if you haven't already, please see your family doctor for a full medical screen and evaluation of your cardiovascular health. Thanks for watching. Please like and subscribe.